Good day everyone, I am Arcely Gamalo, your instructor for today, and for today's lesson we're going to tackle the contagious disease. Okay, what is contagious disease? A contagious disease or communicable disease is a disease that readily spread by transmission of a pathogen from an infected person to another person. And I have here a short video clip about the contagious disease or communicable disease, kung unsa jud si contagious disease or communicable disease nga atong istoryahan.
Microorganisms are a group of tiny organisms, including bacteria, viruses, protists, and fungi. Although most of them don't cause us any problem, a small group of them do, and we call these pathogens, which we can define as microorganisms that can cause disease. As the pathogens can spread from person to person, the diseases they cause are known as communicable or infectious diseases, and they affect both animals and plants. Over the next 3 videos, we're going to take a closer look at each of these 4 types of pathogens, and at some examples of the particular diseases that they can cause. For now though, we're going to focus on how these pathogens spread from person to person, and what measures we can take to reduce this spread. One way they spread is through the air. For example, many airborne pathogens, like the influenza virus or measles virus, can be carried in tiny droplets that we expel when we cough or sneeze. Another route is through contaminated food and water. For example, cholera is a bacterial disease, which is spread by drinking water that's been contaminated by the diarrhea of somebody already suffering from cholera. Meanwhile, salmonella bacteria is spread by eating contaminated food, particularly chickens. Some pathogens have to be spread by direct contact though. For example, athlete's foot, which is a fungal infection that can make the skin on your feet flake off, is often spread by walking barefoot on contaminated surfaces, such as in public swimming pools. Now, the only thing better than treating a disease is to stop it from spreading in the first place. The common sense way to do this is by being generally hygienic, such as washing your hands after you've used the bathroom and before preparing foods, and by cleaning cooking items, such as knives and chopping boards. In some cases, we can kill the vectors of the pathogens, which are the organisms that transport the pathogen, such as mosquitoes, which transport the malaria protists. In the case of insect vectors, the easiest way to do this is by spreading insecticides, which are chemicals which kill insects. The best way to prevent a pathogen from spreading, though, is just to vaccinate everybody. Because if people can't catch the disease in the first place, then they can't pass it on to anyone. If all of these methods fail though, and somebody does catch a disease, then what we can do is isolate or quarantine them. We generally tend to do this only if it's a really serious disease that could really harm other people if they get infected. So just to quickly recap, pathogens can be spread in 3 ways: through the air, through contaminated food or water, or through direct contact. And to reduce this spread, we can do 4 things. We can be hygienic, we can kill the vectors, we can vaccinate people, or we can quarantine people. And as we said earlier, we're going to take a look at all of these in more detail over the next 3 videos.
What are the 10 common contagious diseases? First, measles. Measles is a highly contagious respiratory disease caused by a virus, and it causes a virus in the paramesovirus family, which normally grows in the cells that line the back of the throat and lungs. And for the symptoms, you can experience cough, runny nose, red eyes or conjunctiva, fever, blotchy rash lasting for more than 3 days, or itchy rash. For the treatment, nutritional support and oral rehydration are important to increase body resistance and replace lost body fluids caused by coughing, diarrhea, and perspiration. And you can also take antibiotics as prescribed by physician to treat infections. Second, acute respiratory infection or ARI. It is a leading cause of death in children under the age of 5 in developing countries. And the cause for this is multiple types of virus and bacteria. And for the symptoms of ARI, you can experience cough accompanied by short rapid breathing, fever, difficulty of breathing, and etc. And for the treatment, if antibiotics is needed, health workers must be consulted, or supportive measures include increased oral fluids to prevent dehydration. Third is the typhoid fever. Typhoid fever is an infectious disease which is also known as enteric fever or just typhoid. The cause for this is the Salmonella typhi bacteria. It is a bacteria that infect the intestinal tract and blood. For the symptoms, sustained high fever, headache, malaise or weakness, anorexia or loss of appetite, either diarrhea or constipation, and abdominal discomfort. And for the treatment, antibiotics such as ciprofloxacin for adults and ceftriaxone for pregnant women. Next is the severe acute respiratory syndrome or SARS. SARS is a life-threatening respiratory illness. A coronavirus associated with common colds cause SARS. And for the symptoms, high fever, headache, overall feeling and discomfort, body aches, dry cough, and difficulty of breathing after 2 to 7 days. And for the treatment of SARS, the patients should be referred to the nearest DOH SARS referral hospital for clinical management. Next, tuberculosis. It is an infectious disease that primarily affects the lungs, and this condition is known as pulmonary tuberculosis. It is caused by Mycobacterium tuberculosis or tubercle bacilli. Symptoms: cough for 2 weeks, fever, chest or back pain, loss of weight. And for the treatment, in latent TB or TB infection, INH for children 5 years old and below only. And for active TB, INH is combination with one or more several drugs including rifadin, miambutul, pyrazinamide, and streptomycin for 6 to 8 months. Next, malaria. It is a serious and sometimes fatal disease caused by a parasite that commonly affects a certain type of mosquito which feeds on humans. It is caused protozoan parasite called Plasmodium. And for the symptoms, chills or imong pagpanugnaw, high-grade fever, severe headache, and vomiting. And for the treatment for uncomplicated P. falciparum, these are the drugs you can take. And for the complicated P. falciparum, Plasmodium vivax or Plasmodium ovale, and Plasmodium malariae. Next is the influenza. It is commonly called flu. It is a viral infection that attacks the respiratory system. And it is caused influenza virus A, B, or C. And for the symptoms, fever of at least 38 degrees Celsius, headache, runny nose, sore throat, cough, or other respiratory manifestations, and may or may not have muscle or joint pains. And for the treatment of flu or influenza, use of antiviral agents. Have adequate tests, increase intake of oral fluids and nutritious foods. Take paracetamol for fever, and aspirin should not be given to children. Antibiotics should be given only to complications of influenza. Next is HIV or AIDS. AIDS or acquired immunodeficiency syndrome is a chronic sexually transmitted disease. Acquired means that the disease is not hereditary but it develops after birth from contact with the disease-causing agent. And it is caused human immunodeficiency or HIV. And here are the following symptoms of a person having HIV. And for the treatment, there is no cure for HIV or AIDS, but there are medications that can slow down the progression of the disease. Next is cholera. It is an acute intestinal infection caused by ingestion of food or water contaminated with a bacterium. It is caused by Vibrio cholerae bacteria. And for its symptoms, sudden onset of frequent painless watery stools, vomiting, rapid dehydration. And for the treatment, replace lost body fluids by giving oral rehydration solution or Orisol. If a diarrhea persists, consult health workers or bring the patient to the nearest hospital. And lastly, chickenpox. It is a contagious and common viral infection among children. It is caused varicella virus. And for the symptoms, appearance of reddish skin lesions, weakness, muscle and joint pains, and treatment. Chickenpox rashes will disappear within 1 to 2 weeks without treatment. Give sponge or contagious cold compress on the head for fever. Warm shower or warm sponge bath daily is advisable. Give plenty of fruit juices and water for patient during waking hours. So those are the 10 common contagious disease. Measles, acute respiratory infection or ARI, typhoid fever, severe acute respiratory syndrome or SARS, tuberculosis, malaria, influenza or flu, HIV or AIDS, cholera, and chickenpox. And kung namin nabati nga mga symptoms sa adto nga mga diseases nga na-mention, so why not unsa pa may buhaton? Imong i-apply ang mga treatment so that dili mo grabe ang sakit or makakos pa og kamatay. So that could be all, and thank you for listening.
Amma, I'm back!
What did you learn in school today?
I learned how to fight! Let me teach you! F-I-G-H-T. Fight the spread of infectious disease. Wash your hands frequently. Kill the germs that you can't see. Immunize. Get your flu shot, you'll be fine. Go to the doctor if you're sick.
Stay at home to rest and sleep.
Tissues and masks are a must, cause fighting the spread is everyone's task. F-I-G-H-T. Let's F-I-G-H-T. Let's go! F-I-G-H-T.